Have you ever wondered if masturbation in old age is good for your health? This is a topic that still carries many taboos, but the truth is that sexuality remains an important part of well-being, regardless of age. In today's video, we'll discuss the benefits of masturbation for seniors, how it can contribute to physical and emotional health, and what precautions should be taken for a safe and pleasurable experience. Additionally, we'll debunk the myths surrounding this topic and explore how society can learn to view sexuality in old age with more openness and respect. Don't forget to subscribe and turn on notifications. Masturbation is the stimulation of the genitals for sexual pleasure, with or without orgasm. This practice can be done with hands, objects, or even through fantasies and mental stimulation. It is a natural and common activity at all ages, offering a safe way to explore one's body, relieve tension, and improve emotional well-being. Moreover, masturbation can provide health benefits such as improved blood circulation, stress relief, and better sleep quality. Although still a taboo in some cultures, science has proven that masturbation is a healthy practice and an integral part of human sexuality. 1. Sexuality has no age. Many people believe that sexuality disappears with aging. However, various studies show that sexuality is an essential aspect of overall health and can bring significant benefits to the body and mind. Masturbation, in addition to promoting self-awareness, can help reduce stress, improve blood circulation, and even strengthen the immune system. Masturbation can also be a safe alternative for those who are not in a relationship or who, for health reasons, cannot maintain an active sex life with a partner. Contrary to common belief, sexual desire does not completely vanish with age. It may decrease due to hormonal, emotional, or medical factors, but each individual experiences sexuality in a unique way. 2. Benefits for the body and mind. Masturbation releases endorphins, the pleasure hormones, which help relieve anxiety and improve mood. It can also enhance sleep quality by reducing insomnia, a common issue among seniors. Physically, it helps maintain pelvic health, preventing problems such as vaginal atrophy in women and erectile dysfunction in men. Another significant benefit is pain relief, including muscle and joint pain. The release of hormones during orgasm can promote body relaxation, creating a natural analgesic effect. In men, regular masturbation may also support prostate health, potentially reducing the risk of inflammation and even prostate cancer, according to some studies. For women, masturbation can improve vaginal lubrication, which tends to decrease after menopause, reducing discomfort and promoting better vaginal health. Additionally, self-exploration can enhance self-esteem and personal confidence. 3. How masturbation can improve quality of life. Masturbation is a natural and healthy practice that can bring numerous benefits, especially for seniors facing emotional and physical challenges. Many older adults struggle with loneliness, anxiety, or even depression. Masturbation can be a powerful tool for emotional well-being, as it releases dopamine and oxytocin, neurotransmitters associated with happiness and connection. For men, the practice supports erectile function by promoting blood flow to the sexual organ, lowering the risk of erectile dysfunction. For women, in addition to enhancing natural lubrication, masturbation can help alleviate pain linked to vaginal dryness. For both genders, masturbation provides a way to explore personal pleasure without external pressures or expectations. Furthermore, masturbation can be an excellent exercise for strengthening the pelvic floor, which is crucial for preventing issues like urinary incontinence, a condition that becomes more common with aging. Regular practice stimulates the pelvic muscles, helping to maintain strength and tone. 4. Precautions and safety tips. Although masturbation is a natural and safe practice, some precautions should be taken. Maintaining intimate hygiene is essential to avoid infections, especially for those with lower immunity. If discomfort, pain, or bodily changes occur, consulting a doctor is important to assess overall sexual health. Using suitable lubricants is also crucial, especially for individuals experiencing vaginal dryness or skin sensitivity. Water-based lubricants are safe options that help prevent irritation. For men, excessive pressure or rough movements can lead to skin irritation, so it is vital to respect the body's limits. Beyond physical care, emotional well-being should not be overlooked. Some people may experience guilt or shame regarding masturbation in old age due to cultural or religious beliefs. However, pleasure and well-being are important at all life stages, and there is no reason to feel embarrassed about caring for one's sexual health. 5. Myths and truths about masturbation in old age. For years, masturbation has been surrounded by myths and misconceptions. Some believe that the practice causes health problems, weakens the body, or is a sign of addiction. However, these claims lack scientific basis. In reality, moderate masturbation is completely healthy and an excellent way to maintain intimacy with oneself. Another common myth is that masturbation in old age is unnecessary or inappropriate. However, medical professionals and sex therapists agree that sexuality is a fundamental aspect of human life at any age. There are no limits to experiencing pleasure and exploring one's body in a healthy and respectful manner. Additionally, many older adults feel pressured to hide their sexuality due to fear of social judgment. However, more healthcare professionals and researchers are bringing this topic to light to foster a more open and positive perspective on aging and sexuality. 6. Breaking taboos and feeling good. The most important thing to understand is that there is nothing wrong with masturbating in old age. Everyone has unique needs and desires, and respecting them is part of leading a full and healthy life. If you or someone you know has doubts or insecurities about this topic, seeking reliable information and talking to a healthcare professional can provide reassurance and improve quality of life. Society has made progress in accepting sexuality in old age, but there is still work to be done. Open discussions about this topic can help reduce prejudice and ensure that more people have access to a happier and healthier life. Sexuality is a natural part of being human, and recognizing this can bring greater freedom and well-being to everyone. Masturbation in old age is not a problem. It is a practice that can enhance well-being and health. The key is to approach it in a healthy way, without guilt or prejudice. If you found this content helpful, don't forget to like and share so more people can access accurate information about health and well-being. See you in the next video.